So this report from my patients, from my clients, was in the year 2010 at the age of 42 years old. As you can see, in the hepatitis B surface antigen, it shows reactive, because in this report, you can see that the hepatitis B surface antigen is no longer detected. And another one you can see lower down there is the hepatitis C. Okay, it's actually a core, okay, antibody seems to be detected. That means she tend to produce antibody already. So 1 month later, she went to see the same doctor and then redo the test, and the report shown exactly the same. Doctor requested another test done outside of Malaysia. Okay, this test was done to determine how many strands of hepatitis B DNA or RNA found in the body. We call the PCR test, Polymerase Chain reaction test. And this test came back, result not detected. Not a single strand of hepatitis B virus detected in her body. And only through that, doctor declared her that you are free from hepatitis B, you are no longer a carrier. And spot the fake. Real life testimony, even science failed to explain. Welcome to 100% Real Life Testimony Show. Today, I'm going to present to you 5 independent miraculous healings through nutrition from my patients for the past 20 years. They are proven and evidence-based health transformations, even have science right now can't be able to explain. But there's a catch. Among the 5 testimonies we're going to share today, one is fake. So can you spot it? Let's see what are these 5 testimonies. Number 1 is core extermination, whereby you will see how nutrition assists my patient in eliminating hepatitis B virus. As in the report, you can see my client's having this hepatitis B antigen reactive. That means he's having the virus in his body. Is this a real or fake testimony? The second, vanish with a snap. This is the medical report, blood test report from my patient showing that elevation of CA125. It can be a clear sign of abnormality or maybe tumor growth in her reproductive organ. A further checkup by ultrasound shows that she's having this endometric cyst. And with the help of nutrition, the cyst just vanish. Will this be the fake testimony? The third will be reviving the dead. My patient went through a retina detachment surgery, but unlucky after the surgery, the nerve cells, retina in her eyeball starts shrinking and dying. With the help of nutrition, we revive back the nerve cells. Wow, so miraculous. But is it true or is it fake? Number 4, losing weight with a breeze. Losing 17 kg in just 9 days. This is my client, lost 17 kg in just 9 days. From the size of double XL, become only size M. Wow, 9 days. Is it really true or is it the catch? The last and the 5th will be dislodged and flattened tumor with foods. My patient having difficulty passing bowel went for a blood test, and the reading of CA19-9 elevated together with CA both showcase abnormality in the colon, and he went for a colonoscopy. Doctor ascertained that he having a lot of tumors in the colon obstructing the colon, but luckily it's not cancerous. So did nutrition help him to dislodge and flatten the tumor? Is it even possible? Or this is the fake? Which one is the fake? Is it number 1, 2, 3, 4, or the 5th? Write down your answer in the comment section below. We are going to review to you one by one all the real testimonies. So the last one will be the fake. So are you ready for this 100% real life testimonies that the results are so miraculous until science today can't be able to explain? Let us start with the first real testimony. Number 3, reviving the dead. As we know, some of the cells in the body, once dead, can't be revived, and one of it will be nerve cells. And in this testimony, it focuses on the nerve cells in the eye, in the eyeball, the given eyesight called retina. My patient went for this retina detachment surgery in the year 2023 to fix it back, and then went for the first report. It was in the month of April. From this report, you can see that the right eye having the retina detachment, the average thickness of the retina is only 259, and then the center part is very thin, is only 168, and the total volume is only 7.32. And doctor told her nothing much can be done, there's no medications, and just hope that the nerve cell, the retina, will just heal by itself. But after half a year, she went back for the second checkup. Unfortunately, what happens? The thinning worsened. The dying of the retina cell worsened. So as you can see in the report, in the 1st January in 2024, after half a year, the condition worsened, whereby the average thickness has dropped from 259 dropped to 225. The worst part is the center, the thickness of the center retina from 168 dropped until 46 only, and the volume also dropped from 7.32 becomes 6.37. And throughout that 6 months, it's very miserable for my patient, as she noticed that her right eye seems to be totally without any functions. She can't even see a glimpse of light, and felt so hopeless when doctor told her that her condition worsened and the nerve cells seems to be dying and shrinking. She might have a permanent blindness in the future. That's the time she wanted to give nutrition a try. And I told her, miracles can happen. All you need is to have hope. After 4 months of nutrition intervention, including lifestyle and diet changes and supplementation, she went for her 3rd checkup in the month of May 2024. She was joyfully surprised. Why? Because the reading improved so much and is so miraculous, and the doctor was so surprised too. What happened in May? As you can see that all the readings of the retina seems to improve. It seems like the dead cells or the shrinking cells previously is coming back alive. Wow. If we compare with the January report, you can see the center thickness that shrunk until 46 has bounced back, becomes 254, back to normal. And you can see the total volume from 7 point something drop, shrink to 6.37, now go back to 7.92, a drastic improvement. And the report, the 3rd report, is even better compared to the first, just after surgery in the month of April. As you can see, the center thickness during that time in April 2023 is only 168, and now it is 254. That means it grows beyond the first report. And then the total volume beginning is 7.32, now is 7.92. And my patient also claimed that her eyesight is getting back. Even though it's not a completely clear view, but she can see some light and some image with very blurry image. And that is a great sign. It means that the nerve cells seems to be alive again. So this is a real testimony, and doctors can't even explain, because doctor told her nothing can be done after the retina detachment. Just hope that the cell will grow back, the nerve cells will grow back. And it did with the help of nutrition. This is the first real testimony. Is number 1, co-extermination, eliminating hepatitis B virus from the body. As we can see from this report in the year 2012, is my client's report. That time he aged 44 years old. He's been a hepatitis B virus carrier for a very long time. It runs in his family. Most of family members has the virus. So he's a carrier. And in the year 2001-2, he approached me because besides having hepatitis B for so long, the liver enzyme seems to be elevated. As you can see, the AST, ALT, GT all elevated. It seems to be having some inflammation or damage in the liver, most probably due to this hepatitis B virus. So can we kill it? Can we eliminate it if you're already a carrier? So according to Hepatitis B Foundation, is there a cure for hepatitis B? As obviously you can see here, it's written, there is no cure or medications that totally eliminates the virus or makes hepatitis B antigen negative. It means that once you have the virus in your body, when you go for blood test, the hepatitis B, S small s meant for surface, AG meant for antigens, will be positive. That means you are a carrier of the virus and will be for life. There's no medication that can eradicate it. That means the virus already be part and parcel of your body, residing in your body. But if it gets active, it can actually destroy your liver and even cause liver cancer. And that's exactly what's happening with my clients, my patient. He was quite worried because all the while, the liver is okay, even though he's a carrier. But recently, in the year 2012, the liver enzyme seems to be elevated. That's why he's concerned whether the liver will be damaged. Reading for the hepatitis B surface antigen now is negative or non-reactive. Is this another case of all this error interpretation diagnosis? In Western medication, there's no such case, but in nutrition, among my patients for the past 20 years, this is not the only case. Yes, I have another case exactly like this, and this one will reveal to you the power of nutrition even more surprising. So this report from my patients, from my clients, was in the year 2010 at the age of 42 years old. As you can see, in the hepatitis B surface antigen, it shows reactive but low titer. And for your information, she also a hepatitis B carrier since young. It runs in the family. Everyone's having this hepatitis B virus. So all the years she went for body checkup, the report is the same. Hepatitis B surface antigen is positive or reactive. Until the year 2010, when she already started on nutrition supplementation for quite a few years already. Then suddenly that year, she came to me and looked through her report and saw this low titer, and I was like telling her, "Is this the first time you're seeing this?" She said, "Yes, but doctor didn't say anything. You are still a carrier." Then I told her, "Pay attention because your body immune system seems to be stronger now, seem to be like eliminating, fighting this hepatitis B virus." And she just casually told me, "Yeah, not possible lah, Charles. Because doctor told me that it's incurable. I'm okay with it for all these years. As long as my liver is okay, I don't mind. I'm a carrier." So we didn't pay any attention to that. Then she went for her routine checkup again in the year 2011 and noticed something so surprising. And she was quite shocked too. And the doctor was shocked also. Why? Because in this report, you can see that the hepatitis B surface antigen is no longer detected. Just like the previous case, her body repel all this hepatitis B virus. And another one you can see lower down there is the hepatitis C. Okay, it's actually a core, okay, antibody seems to be detected. That means she tend to produce antibody already. So this is a very unique situation. And some doctors and some professional might tell you that it does happen, but doesn't show that you're completely healed yet, because this is only one report. And that's exactly what my patient being told. The doctor refused to acknowledge that her body able to eliminate hepatitis B virus. Then asked her, "Never mind, you go for another checkup." Okay, went. As you can see, that one was in February. Then the next one is actually in March. So a month later, she was told to redo the checkup because the doctor said maybe due to some technical errors. So it's impossible. Once you are a hepatitis B carrier, the hepatitis B surface antigen is positive or reactive, you'll be having it for life. So 1 month later, she went to see the same doctor and then redo the test, and the report shown exactly the same. It shows that here you can see that the hepatitis B surface antigen is not detected. And the hepatitis E antibody, it means the core antibody, is detected. Same exactly like the previous. And doctor was really surprised. But doctor also asked her to do additional tests this time, just to double confirm. So during the same test time, doctor requested another test done outside of Malaysia. Okay, this test was done to determine how many strands of hepatitis B DNA or RNA found in the body. We call the PCR test, Polymerase Chain reaction test. And this test came back, result not detected. Not a single strand of hepatitis B virus detected in her body. And only through that, doctor declared her that you are free from hepatitis B, you are no longer a carrier. And doctor also quite astonished how you achieve that because you are not young. Your immune system at this age 40 plus, it seems to deteriorating. How can you be able to repel, eliminate all this hepatitis B virus? And my patient strongly just suggest him, you have to take care of health. Maybe you can try nutrition. So the second real testimony is co-elimination or extermination of hepatitis B virus. And it's been done not only once, but twice in my career as a nutritionist for the past 20 years. What an amazing testimonies. If you like what you are watching, we'll be more than happy that you can subscribe to our channel, like our channel, and turn on the notification bell for future videos similar to this. Let us go back to the remaining 3 more testimonies, which is the next third real testimony. Do you have your numbers ready? Let us reveal the third real testimony is number 5. Dislodge and flattened tumor with foods. Just to refresh a bit about this testimony, my patient came to me in the year 2021 with this blood test report indicating that CA19-9 is elevated and CA carcinoembryonic antigen both elevated. And he went for a colonoscopy, shows that it's really having tumor there, but biopsy shows that it's not cancerous. It's just that tumor is very badly inflamed and swells up until it blocks the entire colon. He can't even pass bowel. So every time he passes bowel, there will be bleeding profusely. And doctor suggested him to do the colostomy to operate the area with the tumor, but this will lead to stoma. It means that he can't pass bowel normally through the anus anymore. He need to have a bag, and all the stools will pass through that. That will be permanent. And he refused. Then doctor told him there's another way. You can actually insert a drug through anus to reduce inflammation. This is the mesalazine, as in the photo right here is the amino salicylate that reduce inflammation. So every time he need to insert that drug into the anus to reduce the swelling, only then he can pass bowel a bit more, but bleeding is still there. That's the reason why he came to me and asked whether nutrition can assist or not. As usual, I explained the entire conditions and I explained to him that for your case, it's very, very much your diet changes because your digestive system, the colon, is the main part of the entire digestive tract, and whatever you eat, we need to be passed out through the area, and that is a very bad obstruction there. So the diet changes need to be changed completely, whereby he agrees. And I told him it would not be instantaneous. That means you won't be seeing result in a day or two or month or two. It will be quite some time. It might even take 2 years. And he also agreed because that time is during the COVID-19 time. And then he wants to make a drastic change because he refused to continue with this situation of inserting medication into his anus every time he need to pass bowel. So I requested him to do a food diary or food log that he need to jot down everything that he consumed and drank, at the same time what he defecate out. So he actually took photos of every single item that he consumed and everything that he defecate out. So the next photo will show some of the things that he ate and something he passed out. So you might see some bloods there too. So viewer discretion is advised. In this image, there's actually 3 photos taken at different timeline. The first far left will be the beginning stage when he started out the entire treatment using nutrition. And then the middle one is about 4 months to 6 months. And then the last far right photo is about a year to 2 years after he go on these nutrition interventions. As we can see in the far left, you notice that the frequency of bowel is very, very frequent, and most of the time you can see fresh blood. Then we have the middle. After 4 to 6 months, you can notice that the situation seems to improve slightly. The frequency of bowel movement is lesser, and then lesser blood, and then he seems to be having more food photos in there. And then the far right is about a year plus to 2, whereby you can see his condition already back to normal. He can actually pass bowel with normal solid feces, and most important, he's been taking a lot of other foods already. Okay, from very little food that he can consume, now he can consume almost any food and pass bowel normally. And most important, without using the medication I mentioned earlier on that doctor prescribed to him. So he can pass normally, eat normally now. And then you can see in the photos, he actually even being very delighted to circle the stools that actually got the shape, because for the almost 1 year to 2 years, he just passed liquid stools. Now he managed to pass normal stools and he's very delighted. So you can see that in this real life testimony, with nutrition, you can actually dislodge and flatten tumor if you're using the right way. So his case is a lot of these diet changes, but at the same time, some supplements too, as you can find in the photo. But most important, to let you know, this is a real life testimony. It's a very miraculous healing for him because he no need to go for the colostomy surgery to remove the adenoid part, the colon part, and now he can pass bowel normally. What a great testimony. We have only 2 testimonies left, so which one is fake, which one is real? So far, have you guessed the right one? This is the last chance for you to write down your answer. Which one is a fake in the comment below? And we're going to review the last real testimony. So which is the last real testimony for today? And the answer is, drum roll is number 4. Losing weight with a breeze. Losing 17 kg in just 9 days. As we all know, losing weight is everyone's dream, right? Losing it fast is even better. Usually, in a month, you can lose 2 to 5 kg is considered quite normal, acceptable. Anything above 10 kg is really amazing. For losing weight, 17 kg, not in a month, in only 9 days. Just 2 days plus a week. Is it even possible? Yes, as you can see with my client here, she started with 87 kg and after just merely a week plus, that means 9 days, she dropped to 70 kg. From double XL, become a petite M. And she was delighted. Why? Because the reason she came to see us is not even for slimming that time. She actually attended our skincare workshop that day to know how she can look fairer. This is my client during that time. As you can see, she tried out our skincare that moment and she noticed that our skincare is really good. Then I told her, for your complexion to really have the glow itself, you need to really do something about your health too. Because when you're healthy inside, you will glow in the outside. And she kind of like interested to know what are things I can do besides just applying things on my skin, or is any other thing I can do? Then I told her you can do a detox, a cleansing internally to clear off all the things that your body do not need, and your skin will glow. And she was interested and she started on the 9-day detox program I recommended her. Okay, a little bit of diet changes because it's a very short 9 days, a little bit more exercise and then a lot of nutrients and supplements. And after 9 days, she was completely different person. So after 9 days, as promised, her skin looks so much better as you can see in this photo, before and after. Her dull complexion seems to be completely different now. She actually glows with radiance right now. And her skin is very similar to her daughter. That's what her daughter told me. Wow, mom's skin is so fair at the same time, so smooth. Yes, true. And she was so happy with the skin and that her complexion, but never expected this additional bonus, losing 17 kg. As you can see in this photo, obviously is totally amazing. And when we asked her to share on stage, she actually bought her previous shirt she wore when she's 87 kg, and now she is right now. And she told me that the t-shirt belongs to the husband. Okay, because after 7 days, she shrank so much, she haven't go for shopping yet. As you can see in this photo, I was on stage. I was standing next to her holding the shirt. That was me. And then behind is actually her accomplishment for 9 days that she lost so much weight. And most important, her main intention is to get fairer skin, better complexion, also being achieved. So you can see with the proper nutrition, you can achieve astounding real life transformation, just like this one. You can lose 17 kg in just 9 days. What an amazing testimony. So we come to the last, as you all know, the last testimony is the fake one, is section number 2. So for those who got it right, congratulations. For those who don't, no need to be sad because you can see that all the testimony shared today is really, really miraculous, really, really hard to guess. Even me also, if not seeing with my own eyes, experiencing it because they are my patients, I might not even believe. And what happens to this number 2? Okay, vanishing with a snap. Basically, yes, she is my patient too. She came to me with her report, blood test report, showing that the cancer antigen CA125 elevated, and then a further checkup shows that she has this endometriotic cyst through ultrasound. That is the truth. Okay, nothing wrong with that. But what is fake about it? She didn't actually take nutrition to remove or to counter this issue. She actually went for operation. Okay, she got surgically removed the cyst. Then after that, only she went on nutrition to help her recover better and faster. And that actually what she did. Okay, she officially my patient still, and then she's been taking nutrition too. But nutrition didn't help her to vanish the cyst. Okay, she did it through the conventional surgery. Beside this one, the earlier four truly elevate the power of nutrition in healthcare, and all these real life testimonies, all these astounding miraculous transformation are real and can be achieved through lifestyle changes, diet changes, and supplementation. But ironically, we can't simply believe all these claims, especially coming from supplements, because we need to know, we need to be able to differentiate between the myth and the facts about all this nutrition claim. So how and what evidence we need to analyze before we can even believe in the claims? For that, we recommend you to watch the next video whereby we're going to share with you the top 5 false claims made by health supplements. What are the criteria you need to be certain before even you can believe in those claims? Till the next video, so see ya and take care.